Hi, I'm Dr. Bryan DiMarco at Renew Dental. We often get asked by our patients, what are dental crowns? So I'm here today to answer a few of the most common questions and hopefully to give you a better understanding about what a dental crown is. So patients will often ask me, why do dentists put crowns on teeth? The reason that dentists will put dental crowns on teeth is usually mainly to help to strengthen them. Common reason why we put crowns on teeth is that they simply have not enough tooth structure that's left, usually due to kind of a large cavity or filling that's there, or they've had a previous root canal treatment that has weakened the tooth. The crown, also known as a dental cap, will go over the tooth like a helmet, helping to hold it together to ensure that it doesn't break apart while you're chewing. So patients also will sometimes ask, what are the pros and cons of a dental crown versus a dental bridge? Both of them are slightly different procedures. A dental crown is usually going to be a procedure that goes on a single tooth, whereas we use a dental bridge to replace a missing tooth. So a dental bridge would be you're missing one tooth. We make 3 crowns that are connected together, and they sit on the outside teeth to replace the one in the middle. Patients will ask what type of dental crown would be best for a molar. So in our office, we typically do porcelain crowns. We use our CERA technology, which is just behind me here, that allows us to make you a crown in one day. The material choice that I would typically use for a back tooth is called a zirconia crown. So that is a very strong material, and that's why it's best for the back teeth, because you do a lot of your heavy chewing on those teeth, and we want to make sure that that crown can stand up to the chewing and not break apart. So for front teeth, the best type of crown is usually going to be a porcelain crown. We use one that usually will have a higher aesthetic component to it, which basically just means it looks a little bit nicer because we can put a nice shine on those crowns. So usually a porcelain crown is going to be our best option for your front teeth. So patients will ask, is it possible not to get a crown after a root canal procedure? For back teeth, it's always recommended to get a crown placed on them. Again, you're doing a lot of your heavy chewing there. The tooth is quite a bit more brittle after a root canal. And if we leave it with just a filling, there's a high chance it's going to break and we're going to lose that tooth. The situation is a little bit different though for the front. If we need to do a root canal on a front tooth and otherwise it's still in pretty good condition, we don't have any really big fillings that are there, then we certainly can get away with not doing a dental crown on those teeth. We also hear the question of if dental crowns are as strong as natural teeth. In general, nothing is going to be as good as your natural enamel, which is why we always put such a heavy emphasis on prevention, because we want to make sure that your teeth last you for a lifetime. Although some of the materials that we can use for crowns are, yes, very strong. Like I mentioned before, that zirconia material is extremely strong and very unlikely to break. So some patients are concerned about what type of anesthesia they'll need for their dental crown procedure. For most patients, what we will do is we will give them some topical anesthetic to numb their gums, and then we'll give them a bit of local anesthetic, some freezing to numb up the area. This will help to make things more comfortable while we're working. For patients, though, who do have a bit more anxiety or concern that might not be enough for them, we do offer sedation dentistry at our office. We offer what's called nitrous oxide sedation, also known as laughing gas. And what that is during the procedure, you breathe in this laughing gas. It's a very safe and effective form of sedation. It helps you to feel more relaxed. And then the best part about it is once we're done, it's out of your system in 5 minutes. You can still drive home and go about the rest of your day as you normally would. So once we've completed the procedure of placing your dental crown, a few special instructions that we have after is that we recommend not brushing or flossing the area for 24 hours and avoiding chewing on it. The reason for this is that the cement usually will take a day to harden, and we don't want that crown coming off. After the 24 hours, though, you can go back to your normal brushing and flossing, and then you can go back to your normal eating habits. The only thing that I recommend on a long-term basis is just avoiding anything that's really hard. But in general, this is a good rule even for your natural teeth because we don't want them chipping or breaking on you. So once the crown is put on, patients will ask, how can you tell if there's new decay that forms underneath the crown afterwards? The main way that we do this is through routine examinations. There's 2 main ways that I look for cavities under a crown. That would be using my Explorer instrument, which I will check to make sure that where the crown is meeting the tooth is nice and strong and not sticky. The other main way that we do it is with routine x-rays. The x-rays will help to give us a better idea of if there's any spots underneath that crown. So we often get asked, what is the cost of a dental crown? So the cost of the crown procedure does vary fairly widely depending on exactly which procedures we need to do for your specific tooth. On average, though, you're looking anywhere from about $1,100 to $1,600. But when we get you in for your exam, I will take a look and we will get you a more accurate price. So the easiest way for you to schedule your dental crown appointment would be for you to give us a call at the office or to send us an email. We'll set you up for an exam so we can take a look at your tooth and figure out exactly what's going on, and then we can book your dental crown procedure from there. So I hope I was able to answer a few of your questions about dental crowns. If you do have any other questions, or you'd like more information, or you are ready to take action and book your appointment, please feel free to give us a call at 204-259-3804.